let's talk about obesity then.
Yeah.
Because these stats here are pretty shocking. This one shows the global obesity trends, which just shows them going straight up,
Yes.
which is horrific. This one shows global diabetes trends, which is pretty much straight up as well.
Yes.
Has there been any studies done that show the link between being overweight and your probability of having low libido and some kind of sexual dysfunction issue?
Yes, numerous. And so let's start with this. So obesity, it's not surprising that diabetes is going up because as obesity goes up, it causes insulin resistance. So obesity and diabetes typically go hand in hand. The problem with obesity is the following. Obesity significantly drops testosterone levels. So fat cells contain something called aromatase. Aromatase eats up the testosterone and converts it into estrogen. So the more fat you have, the less testosterone you'll have because you'll convert it into estrogen. Fat cells also secrete something called cortisol and leptin, which shut down your own natural testosterone production. So as it's not surprising that decade by decade, as you see an increase in obesity, you see a decline in testosterone levels in men, because the testosterone levels will come down as people become more obese.
And low testosterone equals low libido.
Low testosterone increases low libido. The number one driver, the number one hormone for libido in men and women is testosterone. It's a strong driver.
Men and women.
Men and women. And don't forget that testosterone is also really important in erectile function. Men need testosterone for sexual function, so do women, right? It's extremely important. So now I have a hormone that's going down, that's gonna make it more difficult to get an erection. I have a hormone that's going down, that's gonna decrease my libido, and it's mainly due to this obesity that's occurring, one of the biggest factors. So obesity. Obesity also, if you look at the risk factors for ED, obesity, diabetes, cardiovascular disease, these are all risk factors. And so as obesity goes up, erectile dysfunction goes up. And the number one condition is diabetes. Diabetics are 4 times more likely to have ED than any other population. 4 times. So I get worried when we see this obesity diabetes pandemic going up because it's increasing only the erectile dysfunction. Stephen, if you look at the obesity, the group that's having the greatest rise in obesity is adolescents obesity, not adult obesity. The kids, younger and younger ages, are having, that age group has the greatest rise of obesity. So what does that turn into? The younger population are starting out at lower T levels, and it has an implication on fertility because you need testosterone to produce sperm. That's very important.
So if I just lose a little bit of weight, that'll have a big impact on my testosterone levels.
Let's talk about that. It's not a little bit. So the best study was at the European Male Aging Study, Fred Wu, and what he showed was this. It's a bi-directional relationship. If you lose 10% of your body weight, you can actually gain 85 nanogram per deciliter in serum testosterone. If you lose 15% of your body weight, you can actually gain 250 nanogram per deciliter in serum testosterone. So it's actually significant if you can lose, but it also goes the other way. You gain weight, you drop the T proportionally as well. The only issue is I can get the patients to lose the weight, but I can't get them to sustain it. Many times they gain it back, right? But if they can keep the weight off, it significantly increase the testosterone levels. The best data we've seen is in the bariatric surgery data. If I do bariatric surgery on a patient,
which is
to help them lose weight, you can shrink the stomach. We do surgery to help them lose weight. They lose quite a bit of weight. Their T levels go quite up, right? And so again, there is a strong correlation between weight and testosterone.